Imagine if the dish soap in your kitchen slowly turned into tiny stones and started blocking the sink. Picture water backing up, the drain clogging, and the frustration of something meant to clean becoming a problem. That's basically what happens inside your body with gallstones. Over the next few minutes, the narrator guides you through what gallstones are, why they form, what symptoms they cause, and how they're treated without overcomplicating the science. Let's start with a quick map of what's involved. On the right side of your upper abdomen, tucked under the ribs, sits the liver. The liver makes a digestive fluid called bile. Think of bile as a biological dish soap. It helps break down the fats you eat so your intestines can absorb them. Bile flows from the liver through small tubes called bile ducts into a small pear-shaped storage bag called the gallbladder. The gallbladder's job is simple: store bile, concentrate it, and squeeze it out into the small intestine when you eat, especially after a fatty meal. So liver makes bile, gallbladder stores bile, bile helps digest fat. This map keeps the story grounded: production, storage, and release. Now, what exactly are gallstones? Gallstones are solid lumps that form from components of bile. Instead of staying a smooth liquid, some substances in bile, especially cholesterol, can crystallize and slowly grow into stones. Most gallstones form in the gallbladder. Though they can move into the bile ducts, they can be as tiny as a grain of sand or as large as a golf ball. There may be a single stone or hundreds of small ones. Interestingly, most people with gallstones never feel anything. These silent gallstones are often found by accident on an ultrasound or scan performed for another reason. There are two main types of gallstones. First, cholesterol stones, the most common in many Western populations, form mainly from cholesterol that has come out of solution. Second, pigment stones are made mostly of bilirubin pigments and are more common in conditions like chronic hemolysis or liver disease. In everyday terms, cholesterol stones are the fat-based stones. Pigment stones are the breakdown product stones. Keeping this distinction helps explain why different health situations raise different risks. How do gallstones form? For cholesterol stones, three main things tend to go wrong. First, too much cholesterol in bile. The liver puts more cholesterol into bile than the bile salts and phospholipids can keep dissolved. The bile becomes supersaturated, like adding too much sugar into a glass of water. Second, nucleation. When bile is supersaturated, tiny cholesterol crystals start to form. Mucus and proteins in the gallbladder can act like glue, helping these crystals stick together. Third, gallbladder hypomotility. If the gallbladder doesn't contract well or empties too slowly, such as during fasting, obesity, pregnancy, or under certain hormonal influences, bile sits there longer and crystals have more time to grow into stones. Over time, these small crystals gradually build up into larger problematic stones. Who is at risk? The teaching shorthand of the 4 or 5 Fs captures common patterns: female, 40, fertile, fat, and sometimes family history. More precisely, risk factors include being female due to hormonal effects, increasing age, obesity and metabolic syndrome, rapid weight loss or crash diets, pregnancy or estrogen therapy, family history or certain ethnic backgrounds, and conditions such as diabetes, some liver diseases, and hemolytic disorders. These factors can either increase cholesterol secretion into bile, slow gallbladder emptying, or increase pigment load, depending on the situation. Most people with gallstones feel nothing, but trouble starts when a stone blocks bile flow. The classic symptom is called biliary colic. Despite the name, it's not the same as intestinal crampy colic. It's usually a steady, deep pain in the right upper abdomen or upper middle abdomen, often beginning after a fatty meal and sometimes radiating to the back or right shoulder blade. Pain builds over minutes and lasts from about 30 minutes to a few hours, often coming in episodes with normal periods in between. Nausea or vomiting can occur, but between attacks, the person often feels completely normal. Routine tests might be normal if there's no complication. When gallstones get serious, they can cause complications. Acute cholecystitis is inflammation and sometimes infection of the gallbladder wall. Pain becomes more prolonged and severe, often with fever and tenderness. Choledocholithiasis refers to stones in the common bile duct. This can block bile flow and cause jaundice, and if infection develops, it leads to cholangitis, a medical emergency with fever, chills, and low blood pressure. Gallstone pancreatitis occurs if a stone blocks the area shared by the bile duct and pancreatic duct, triggering acute pancreatitis with severe upper abdominal pain that often radiates to the back and can be life-threatening. So while many gallstones are harmless, obstruction in key areas can be dangerous. Diagnosis typically begins with abdominal ultrasound. It's non-invasive, uses no radiation, and is excellent at detecting stones in the gallbladder. Blood tests can look for signs of infection or inflammation, liver function changes, or pancreatic involvement. For suspected stones in the bile ducts, MRCP or endoscopic ultrasound may be used. Treatment depends on symptoms. Silent gallstones are usually watched for recurrent pain or complications. The main treatment is cholecystectomy, removal of the gallbladder, commonly done laparoscopically through small incisions. If stones are stuck in the common bile duct, an ERCP can remove them. Non-surgical options exist for a few patients, like medications to dissolve small cholesterol stones, but they're less common and recurrence is a concern. Can gallstones be prevented? You can't control everything, but you can reduce some risks. Maintain a healthy, stable weight, avoid crash dieting, eat a balanced diet with fiber, stay active, and manage conditions like diabetes with medical care. These steps support healthy bile composition and gallbladder motility. Takeaway: gallstones are solidified bile, usually forming silently in the gallbladder. Most never cause trouble, but when they block bile flow, they can trigger intense pain and serious complications like cholecystitis, jaundice, or pancreatitis. Understanding what gallstones are, why they form, and how they're treated helps turn a scary diagnosis into something you can make sense of and act on with your healthcare team if needed.